2010, the very first Human Rights March at an international AIDS conference took place on a Tuesday evening in July. It was July 20th in Vienna, Austria. And we marched along the Ringstrasse, which is a very historic part of Vienna. There were tens of thousands of people who showed up from all over the world. I remember seeing African nuns marching next to a gay couple from Argentina, marching next to Russian drug users, and thinking, what is it that is tying these people together? And I think it's the idea of human rights.
I never imagined we'll have not just the number of people, but the quality of participation. It looked like everybody just turned out and said, this is important.
We came out here tonight to march in support of human rights to those living with HIV/AIDS.
Very simply, human rights are key. If we don't have human rights, nothing matters. In my country, people who are living with addiction have hardly any rights at all, and certainly they're considered the most terrible people in our country. And I live in Canada, for God's sakes, it's wrong.
I remember leading the march and walking under the arch through the gates of Heldenplatz and saw thousands of people congregating on behalf of the most marginalized people affected by HIV in the world.
This is what it takes to end the epidemic. We need the urgency and the power and the emotion and the energy of people living with HIV, fighting against the racism and the stigma and the homophobia and the sexism that allows the epidemic to persist.
It's not enough to respond to HIV just with medical interventions. And after all the science is done, and the labs are closed, and the pills are manufactured, you've got society to deal with. And that virus is just as smart at exploiting social weakness as it is at exploiting the weaknesses of the immune system.
We must realize that universal access to HIV prevention, treatment, care, and support will never be achieved without human rights. There is no way we are going to ensure that you prevent new infections if people cannot even access those prevention services. If people are criminalized, they cannot come out to access services, so you can't do prevention. So we must treat people like human beings, not like fugitives. And that's why we say if you do not have that, there is no way you can achieve universal access.
We want human rights now than ever. Rights, especially rights for women, should be recognized as rights for all humans.
In my part of the world, over 60% of infections are in women and girls. And so you've got women who have no voice and no rights, where you cannot tell your man if and when and how to have sex, where if you live in the context where you know that you're not even the only woman here. And in my particular case, me being faithful did not prevent me from having HIV. So you're saying, how then do you address the issues of women? What about violence against women? You dare not go back home and tell your husband or your partner, or whoever you're with, to say, I've got HIV, because you can lose your home. Also, the rights and the needs of children and young people are mainly ignored in our response to HIV, yet they're the most at risk in most countries. And more broadly now, we don't have youth-friendly services, services that address a young person holistically. A 15-year-old girl cannot access treatment where I access as a 40-year-old, because that child in that setting is completely disempowered.
populations who are most affected by HIV are among the most stigmatized, the most marginalized, the most discriminated against in society. Is the woman who is supposed to be taking antiretroviral medications in a violent marriage? Is the drug user who is supposed to be using the needle exchange program constantly arrested and sent to prison? And I think about sex workers in Asia who are afraid to carry condoms with them when they go to work because they think the police will confiscate their condoms from them. This shows that it's not enough to provide medicine, to provide prevention tools, to provide commodities, to provide health services. HIV makes us ask questions about the kind of society that we live in. I remember at one point in the march, I found myself marching next to a group of Chinese activists. They practically had tears in their eyes. And they said to me, we couldn't do this in China. We couldn't march. We'd be arrested. That march was full of people who could not lawfully do at home what they were doing in Vienna.
I come here as an activist because I'm fighting for LGBT rights in Uganda, in Africa, and I'm proud that we're expressing our voice for the voiceless.
I remember meeting an HIV doctor in Nairobi who was complaining to me once that he had a lot of patients who were coming for antiretroviral therapy. And they were saying to him, you know, it's very hard for us to take our pills at home because our husbands don't know. And if they found out, they'd beat us up. So what did we do? We worked with this doctor to add lawyers to his medical team. And these lawyers helped these women to get protection orders from their violent husbands. And lo and behold, they started adhering more regularly to their treatment regimens. I think we're at a point in the epidemic that although we've poured billions of dollars into it, it's still not enough. And one thing that we're demanding is more funding for a very specific set of programs that complement medical interventions. And these programs include things like legal aid services, reforming laws to make sure that they facilitate an HIV response. And yet a very small percentage of global AIDS funding goes towards those kinds of programs. I think the human rights idea really resonated with people in 2010. And that's why tens of thousands of people showed up in Vienna on July 20th.
People, what do we want? We want human rights for people with AIDS, human rights for ID users, human rights for sex workers, human rights for women and girls, human rights for men who have sex with men.
We will fight for our rights to get treatment, to live with our beloved ones, to raise our kids, to laugh and to see new happy day.
It is our birthright to be treated with respect. It is our birthright to be treated with dignity. Human rights here, human rights now.
We stand here tonight, united in solidarity with one voice, one call to action. We're speaking directly to global leaders to demand that they keep their promises and commitments to global access to treatment, prevention, and medical care.
The takeaway of this event is that human rights and HIV is a movement, and it's a global movement, and it's a diverse movement. And what that means is that it will be impossible for anyone to deny that there is a mandate behind the idea that human rights must be at the center of this response.